One of the things, of course, is that we've been having an increase in case counts again due to this Delta variant. And, there's a lot of questions about if we're peaking yet or not, and we don't really know. We're hoping we are peaking soon. But one of the things I think that is different with this kind of current peak with COVID is that it's affecting kids more, probably because of vaccination. But one of the other things I've been noticing is we're also having a lot of what's called RSV, it looks like, in our community. So RSV is a virus, respiratory syncytial virus, that affects kids in particular in their lungs. And so I'm wondering if you might be able to share with us a little bit about what you're seeing in the community and clinical practice, particularly in kids with both COVID and RSV, and how these two viruses are playing out right now in our community.
Absolutely. That's an excellent question. RSV is a common virus that we see a lot of times in the winter and is associated, especially in kids, with a whole bunch of coughing and kind of mucus production. And it a lot of time, unfortunately, a lot of times can result in kids having to be seen in the hospital and receive some supportive cares and stuff like that. The RSV this year has been very early. We've been very surprised to see so many cases, and a lot of that probably does harken back to that people are not practicing as many of the masking and the social distancing as they were in the past. Over the past year, several of the respiratory viruses were pretty rare, actually. The masks were really effective, and the social distancing and hand washing were very effective in reducing how much we were seeing of those viruses. But this year, we're starting to see some more of the RSV, and especially when it comes to in coordination with COVID, it's hard to distinguish between the two of those clinically. And as our hospitals, and not just our adult hospitals, but our children's hospitals, are starting to fill up with COVID cases and patients, we are seeing that it's hard to manage the increased number of patients that are coming in with RSV as well. And so that's especially an encouragement that we shouldn't lose sight of these other viruses, and really need to double down on some of these interventions of masking, hand washing, and especially vaccinations.